I think the other one probably you could help with as well, which I know we've had discussions about, is a lot, and we do hear this a lot, about how quickly the vaccine has been developed and obviously come to market effectively. So therefore it's all been rushed and it's experimental.
So I think that might have been probably held more hope, sway 12 months ago, but now we've given 7.5 billion doses across the world. It's probably been the most widely given drug ever in the world so far. So I think that some of those debates, but I mean, the reason it came to market so quickly was, one, the amount of money invested in it was by far and away more than any investment in any drug before. And one of the things about clinical trials is you're normally looking for a patient population that is quite small. Obviously, because COVID was rife, we had a lot of people we could give it to as well. So it went through all the right checks that any drug would go through, and therefore it came to market quicker, mostly because there was more money and there was more people deployed in doing that. But there was none of the checks were rushed through. They've now all got a license. They didn't all have a license originally. They all got an exemption license, which is not quite the same, but now the drugs have, because they've been so widely given. As I say, it's about 7.5 billion doses that have been given now, which is probably, I suspect, Gavin, that's the most widely given drug in the world. I can't imagine anything else has ever been given to 7.5 billion times.
I think actually it's more than that. I'm understanding.
Yeah, I think it is, but I don't know how many. It's over 8 probably by now, but it was 7.5 billion a few weeks ago. We've given over, I suppose, in context, there's over 1 million doses been given in Bradford district and Craven alone, which is quite. That's probably easier for people to understand, that we've actually given over 1 million doses, and we hit 1 million the week before Christmas.
So just coming back on those points, I just looked, 9.33 billion doses have now been given. So I think I very much go along Tracy's view. It's probably one of the drugs that we've given the most. Just picking up on a couple of those bits, talking about the expediency of developing the vaccine. I don't know if you can cast your mind back to, I think it was around about 2007, 2008, there was a SARS outbreak. I remember working in a critical care unit in central London at the time. We had a SARS patient at the time. And it was following that SARS outbreak, which is when the drugs companies started doing the research into the coronavirus, which is very much where the COVID vaccines come from. So actually the building works of this wasn't just done starting in 2000 when we first heard about COVID. The work for this actually started being developed back in the 07, 08, 09. I can't remember the exact year, all those years merge into one. So actually this work has been ongoing and has been going through a period of time. And as Tracy said, what often takes the time of clinical trials is all the bureaucracy between phase 1, phase 2, phase 3. And obviously as the entire world and the country is focused on this, they could cut through the red tape much quicker than they would do, as opposed to it being on the bottom of someone's to-do list and actually getting to the top of it at some point to then progress it through the different trials. And as Tracy said, it's gone through every single trial, and plus on top of that, we now got over 9 billion doses worth of data.